Hello all, this is Dr. Dheeraj Masapu. I am a neuroanesthesiologist and I give anesthesia for brain and spine surgeries. I do reaction videos and I react to medical videos, and I'll give something called as a reality score. So in this reality score, I'll tell you how real this video is to the current medical practice. So today I'm going to react to a video which is done by an emergency physician called as Steve, and let us react to the video.
Okay, you two, so unfortunately your son's arm is broken. Oh no! Dad, it hurts! It's gonna be okay, son. What needs to happen? The first thing we're gonna do is get him an IV. That way we can give him some ketamine to knock him unconscious. Then the doctors will come in and reduce the bone, which is just another way of saying put the bones back in place. Okay. Is it gonna hurt him? It's not gonna hurt him, is it? The hardest part will be getting the IV, but once we get him the ketamine, he shouldn't feel a thing. Is ketamine safe? Very safe. It's gonna look a little scary because he may be unconscious with his eyes wide open, but that's normal. And we're gonna be monitoring his vitals the entire time, okay? We do this a lot. And like I said, the hardest part is probably gonna be getting his IV. We may have to wrestle him down a little.
So here the situation is one of the arms is broken and they're going to reduce that under anesthesia. He is trying to give something called as ketamine, which is a drug which produces some kind of anesthesia. So in current medical practice, and as an anesthesiologist, I usually don't use much ketamine. I was using actually 10 years back, but I don't know about the emergency physicians and what their practices are. So the drug that we use to sedate any child is called as Sevoflurane, and it will be given through such kind of a mask in a smaller size, and the kid goes into sleep. Once he goes into sleep, then we take an IV line so that the child will not remember any of this. That is how we do. Let's continue the reaction.
Oh my god, no, I can't watch. I have to wait outside. I guess it's just me. Parents choose to wait outside all the time. Again, very normal. This isn't easy to watch. Thanks, Rich. I'll stay. Okay.
Yeah. Here I would like to tell something. It is not always true. We always take the parents inside the operating room and we use this mask and we induce the child inside the operating room, and then we take the IV line. So once the child is under, that means when the child is sedated, then the parents go out of the OT. That is what we practice, and maybe because their practices are different, they don't allow the.
Okay, then let's get started. Alright, we're done. X-rays look good, bones are back in place. Thank goodness. I'll go get my wife, tell her the good news. Don't be afraid if he says some funny things as he's waking up. That's normal with the ketamine. Okay. You did so good, my boy. Mommy calls Daddy a good boy when she hits him at night. I'll leave you to a minute.
So this is absolutely true. So what ketamine does is it causes something called as hallucinations. So when the patient is recovering out of the ketamine, so they don't remember what is happening. They just behave as if they're dissociated from the surrounding, and they'll keep talking some random stuff. This is called as hallucination or delirium. This is very commonly seen. To counteract that, we use some drugs called as benzodiazepines. Most commonly used drug is midazolam, and even stronger drugs like propofol also can be used to prevent this phenomenon. So maybe they wouldn't have given that. That is why they're saying this kind of reaction. But now in the current medical practice, we are not using much ketamine. We have moved out of that. There are some reasons for that. If you want to know, I'll tell you. One, I personally feel that using ketamine causes more respiratory events, even though they claim that it's more safer. Like laryngospasm risk is very high with the use of ketamine, and we don't want unnecessary delirium during the recovery period, which is very disturbing for the patient and the people who see that. We need a very smooth recovery from the procedure. Now coming to the reality score, I don't see anything unreal in this video because it's pretty straightforward. So I give a reality score of around 9 out of 10 because a patient coming with a broken bone, giving ketamine and explaining the patients, there is nothing unreal here. So 9 out of 10. And so that's it about this a short video, and thanks for following the video. I'll do more reaction videos in future. Dr. Dheeraj Masapu logging off.